Today we are at Southwest General talking to Dr. Deucher about a crucial test to assess your heart health. Dr. Deucher, tell us about this test, what's it called, and what's it all about?
Good question, Sarah. It's called a coronary artery calcium score. It's a quick CAT scan, which is a fancy x-ray. It takes about 2 or 3 minutes. So it's the best test to detect coronary artery disease, which is the #1 killer of any man or woman over age 65 in this country. So a normal score, of course, should be 0. So 0 to 100 is low risk. If you get over 400 or 500, it gets a little more concerning.
Okay, Betty, you had this test.
I did.
You're a patient. Tell us your story.
I was seeing him for my yearly exam, and something told me to ask him about my heart and my numbers. And I said, what are my numbers? How are things flowing? And he said, we don't know, but we can find out. So he scheduled me to take this coronary calcium score. He said, I'm sure it's going to be 0, but it came up a higher number, over 500, which then led him to recommend a stress echo, which showed a problem on the left side of the heart. And then he asked me to take a heart cath, which then showed my main left artery, the widowmaker, was 95% blocked.
Wow, which led to surgery, and now
Yes, it did.
you are in wonderful health.
Absolutely.
This is amazing.
Better than I was before. And they said I probably wouldn't have made it much longer, let alone go back to my next visit in a year.
Why is it so important for people to advocate for their health?
Because healthcare is a two-way street. I need to listen to him or her, know where they're coming from, what their symptoms are, and then work off of that.
And Betty, that certainly was true for you.
It was very true for me. My gut feeling was to not leave his office without asking him about my heart. And he did a good job of listening to me, because he easily could have said, Betty, you're okay, you have no symptoms, I'll see you back in a year. But he just sat there, listened to my concerns, my worry, and he said, let's take that coronary calcium test.
How do people get this test?
Their doctor or nurse practitioner can order it, any healthcare provider, so you don't have to be a cardiologist, and we offer it here for free at Southwest General.
To learn more, go to thatsmyhospital.com.